it's great to be around like-minded people that are trying to better themselves or purpose-driven. And so that's a big part of what I'm going to talk about today is some of that purpose-driven life. I met Jesse, and I've been on the accountability calls on Tuesdays, been to a couple meetings, and it's been great. And just hearing everybody's stories and hear about what you're struggling with or all your successes, your struggles, everything. I mean, it's great to be around like-minded people that are trying to better themselves or purpose-driven. And so that's a big part of what I'm going to talk about today is some of that purpose-driven life. And so a little bit about me. So I grew up in Pomona. I ended up going to Damien High School, just in the area over here. And then I went to USC for my undergrad and then moved to Miami. I did a master's degree out there. And then I went to medical school in Pomona at Western University, got my degree there. And then I did general surgery and vascular surgery at Loma Linda University. And I worked at the VA and the university there for several years. And then I went into private practice and in vascular surgery. And so I don't know if you guys know anything about what vascular surgeons do, but we're basically plumbers. So it's kind of like we're just, but just like, just like pipes, right? Over time, if you don't take care of yourself, the pipes clog up, right? And that's called atherosclerosis. So that comes from diabetes, high blood pressure, uncontrolled medical conditions, stress, poor diets, all those types of things. So by the time you see me as a vascular surgeon, you're at the end of the road. So if you're on the raft of disease, you're already over the waterfall, right? And so at that point, there's really no cure. It's just palliative care at that point. And I'm just trying to get people to maybe live another few years. In the meantime, I'm doing a lot of amputations, a lot of bypasses, cleaning out arteries, just kind of managing the stuff that happened over the last 30 to 50 years of their lives. So I kind of had an aha moment about 5 years ago, and my mom was getting really sick and she had a lot of health problems. She had broken her hip and was at Kaiser and nobody was helping her, and she was just really deteriorating. And my business partner kind of introduced me some of the stuff in regenerative medicine. So his mom was sick, so we started treating our moms, and lo and behold, my mom went from not being able to walk up the stairs, and then 3 weeks later, after I gave her stem cells and started doing some other treatment, she was walking up and down the stairs. And I said, wow, there's something going on that's wrong with the system here, right? And what we do as physicians. And it made me realize that the body's really capable of doing a lot of miraculous things that our healthcare system just does not tap into. We have one of the best healthcare systems in the world. We're really good at keeping people alive. Our hospital systems, best in the world, right? You could go in there dying and come out, but we're not good at keeping people healthy. Right? And that's really where a lot of healthcare dollars are lost, and a lot of productivity in our lives are lost by the time we're getting into those chronic medical conditions that are keeping us from living our best lives. So that's where I felt my purpose became that, right? So I shifted into what became VivaLife Healing Centers, and then eventually opened up Empower Men's Health, where I wanted to really focus on men's health as well, because I feel as men, one, we don't like to talk about our health problems, and we see it for some reason as a sign of weakness. And then society in general doesn't like it when men start talking about their health problems. It's not supported. So if you, and I'm not trying to be sexist or anything, I'm just telling you the facts. Like when women come in and they have a lot of problems, well, they're able to talk about their hormones. They're able to talk about all these types of things. Guys, I hear it all the time. They go into their doctors, they tell them they feel like shit, and the doctor says, well, you're just getting older. Right? And they put them, and a lot of guys are saying, oh, my doctor just put me on an antidepressant. And I'm like, what? Like what? Why? Right? Antidepressants are one of the worst things that you could be on. And there's so many other ways that you can benefit your life without being on an antidepressant. Right? And so I really feel that men really need to be taken care of. And that's been one of my passions, is really getting men feeling better. Anywhere from hormonal health to diet, lifestyle, nutrition, weight loss, sexual wellness, which is another thing that guys just do not want to talk about, but there's a lot of options out there, and we don't have to age in a bad way, right? So that being said, let's go. So I'm going to talk about optimizing health, vitality, and high performance individuals. So what's a high performance individual? Most people think, oh, athletes, but Entrepreneurs, anybody that's trying to live a purpose-driven life, anybody that's a dad, that's a high performer, right? Anybody that's really trying to better themselves is a high performer, right? Somebody who's looking for something better. So that's the first thing. So today we're going to talk about one of the biggest things with health and wellness, and that's sleep optimization. And I'm going to tell you why that's so important. Positive relationships, life balance, and personal development. And that's, if you're in this room, you're already trying to do that. But I'll tell you the science why that's so important when you're talking about vitality and health. Diet, supplementation, intestinal health, core foundational health principles. And then I'll get into a little bit of what's called biohacking. Have you guys heard of biohacking before? Yeah, biohacking. Really, it's really should be called precision medicine. It's where science and technology meets science. And we kind of combine the two, and we are able to get hacks into the human body and help it function at a more optimal state. Hormones, huge piece of the puzzle for health and wellness, hormone optimization. And then I'll talk a little bit about what we do at my center. So let's start out by talking about sleep. So anyone who comes into my office and they're struggling with problems with their health, the first thing that I start addressing with them is their sleep. Okay, because most people have sleep problems. I would say 70 to 80% of the population has some sort of sleep problem. Why is that? Well, our lives are super busy. Everybody has families. Everybody's trying to run a business. Everybody's in a job. They're trying to mix in leisure activities. So like for myself, by the time I get home at night, it's 8 or 9 at night, which is not great, number one. But then it's like, I don't want to just go to bed. I just got home. So then I want to enjoy myself a little bit. Next thing I know, it's midnight, 1 in the morning, and haven't gone to sleep yet. Right. And then I'm up at 5. So, and just to do it all over again. So how many can relate to poor sleep habits, right? Right. So have anyone heard of the 10-3-2-1-0 rule when it comes to sleep? Okay. So I'll make it real easy. 10 hours before bedtime, no caffeine. 10 hours. I'm done. Right? Yeah. 3 hours before bedtime, no alcohol, no food. 2 hours before bedtime, no work. No work? No work. 2 hours. 1 hour before bedtime, no screen time. Okay, no TV, no screen time. And the 0 is no snooze button in the morning. Okay, how many people hit snooze buttons in the morning? All right. Okay, so that's right. So let's talk about why this is. So the pineal gland. The pineal gland it's in our brain. It's kind of in the midbrain area. It really regulates our circadian rhythms. So it really regulates our sleep-wake cycle. And so what happens is if we're not sleeping properly, if we're not going to bed at a certain time, and really what we need as adults is somewhere about 8 hours. Infants sleep about 16 hours. Teenagers sleep about 10 to 9 hours. We need about 8 hours of quality sleep. It's not necessarily the quantity, it's the quality. So what happens is once that circadian rhythm gets out of balance, the pituitary gland then gets out of balance. The pituitary gland is our master gland, right? So that produces all of the releasing hormones in the body that regulates all of our hormonal milieu in the body. And so that can lead to lots of problems with cortisol, all your hormones, testosterone, if you're a woman, estrogen, and guys, estrogen as well. Your thyroid, so your adrenals, your thyroid, all your sex hormones, everything just gets out of whack. And if you can imagine, once all that happens, if that happens for years and years and years, you're going to develop chronic health conditions, right? So, so we just talked about a little bit about this. So chronic sleep deprivation or irregular sleep patterns disrupt the natural rhythm. Elevated levels of cortisol are really bad for us. Okay, they lead to high blood pressure. They lead to weight gain. They lead to high cholesterol, mood problems, depression, anxiety, all these things, and it all stems from the pituitary gland dysfunction. Do you have a question?
Sorry. Yeah. So cortisol is known as a stress hormone, right?
Yep.
So what does cortisol cause stress or stress cause cortisol?
Good question. So it turns into a cycle, right? So the stress causes the cortisol, but chronically elevated cortisol levels will stress the body out, and then it turns into this cycle of stress creates cortisol, cortisol creates physiologic stress and mental stress, and then that will continue to perpetuate over time. And actually what can happen in extreme cases, and I did trauma surgery for a long time, lots of stress, right? I treat a lot of law enforcement, I treat a lot of fire first responders, and there's a syndrome called adrenal fatigue. And so once your adrenals can only handle so much for so long, and at some point your adrenals are F you and they just shut down, right? And so there's a specific pattern of fatigue that can happen when that occurs, because your circadian rhythm becomes backwards. So really, when you're talking about sleep deprivation and stress, you want to see cortisol levels very high in the morning, because that's when we're getting up and we're ready to go. And then throughout the day, the cortisol levels sequentially drop. And by evening time, they're at their lowest. But when you have adrenal fatigue, it actually flips. And so what happens clinically is that you have a very hard time getting up in the morning because cortisol levels are not where they should be. So you have to caffeinate. And then around 1 or 2 in the afternoon, you feel like you need to take a nap. And then in the evening time around 6, you feel like you need to go to bed. But if you power through it, then you can stay up till 1 or 2 in the morning, right? Because the cortisol levels start rising in the evening time instead of declining in the evening time. So this circadian rhythm gets completely backwards. Does anybody have that pattern of fatigue, right? I had it. So when I was doing trauma surgery, my adrenals were not functioning at all, because I would go from 0 to 100. I'd go from sitting in the call room watching Law and Order, then get called to a gunshot and have to operate for 3 hours. Then I drink 2 glasses of coffee, and then I would lay down and go right to sleep. So I had no ability to manage. My threshold for stress was so high that my adrenals couldn't even keep up. So any questions on why sleep is so important? Okay. Yes.
So when we do have that, how do we fix it?
That's when you come to me. So, but we're going to talk, because all the stuff we're talking about is all interrelated, right? So it's not, these don't exist in silos. Sleep doesn't exist in a silo. Like I just said, so once you have a sleep problem, then you have a hormone problem. Once you have a hormone problem, then you have a full body physiologic problem. Then you have depression, then you have anxiety, and it all just spirals into really bad health, right? So let's talk about relationships. So we all have been in probably bad relationships. That one girlfriend that was super toxic, or that one boyfriend that was super toxic, or a business partner that really just drained you, or a parent that was narcissistic, or a friend that just never had your back, that caused a lot of stress, right? I mean, I have. Does everybody had bad relationships? I'm sure we all have. How did we feel in those relationships? Probably stressed, anxious, maybe depressed, always on edge, right? So what's happening when we're having bad relationships? Well, we're getting the stress hormones, right? We're getting that pituitary gland dysfunction. We're getting, sometimes our neural wiring gets hijacked and we're searching for dopamine all the time, right? Dopamine's our happy hormone. And some people, it becomes so bad that that neural wiring, like that craving for the dopamine, will get them to stay in those relationships, because when it's good, it's good. But when it's bad, it's bad. It's like a drug, right? And that doesn't have to be romantic relationships. That can be any relationship, right? So just this quote here: in the fast-paced world of high-performance individuals, the pursuit of success often comes at the expense of holistic well-being, right? I'm guilty of it, not taking care of myself for the benefit of my work or anything else, right? So actually putting work in front of relationships, putting work in front of life balance. But what I've learned recently, and I've been reading a lot of personal development books, whatever's going on in our life that's not going well is a mirror of what's going on internally with us, right? It's a mirror. Whatever we're attracting into our lives starts in here. So part of that is changing our internal and making that project to the external, right? So a lot of our relationships, we internalize what's going on with those relationships and we project it back out to the world, and that then attracts that back to us, right? So we don't want that, right? So let's talk about some of those strategies here. So we have to prioritize these positive relationships for our lives, right? It's for our health. So the emotional support that it brings. Humans are designed to get 8 hugs a day. What do hugs do? Hugs give us dopamine. I don't want to get all mushy gushy, but it doesn't have to be hugs, but it can be just positive interactions with our individuals, right? This enhances our immune function. It lowers cortisol levels. It increases dopamine. It increases serotonin. Serotonin's another one of our happy hormones. We get that after eating or after sleeping. Our serotonin levels are higher. After exercise, our serotonin levels are higher. Aside from the positive relationships, part of that is also strategies for achieving life balance. Self-care, very important. Nick's really big on this. So if you want to talk to someone about great life balance, talk to Nick. He has a great morning routine, right? You do everything. You carve out times, and he talked about this at the last meeting that was really good, where you do 2 things in each category: spiritually, what was it? Relationships,
working out, and diet.
And diet. And he sends out 2 gratitude texts every day to somebody, which you talk about that interaction and how that comes back to you emotionally and sending that out to the world. I mean, that's huge, right? So setting boundaries, this is huge, right? I know I do it. I overextend myself. I work too late. People ask me to do something. I know I can't do it, but I say I'll do it anyway. Then I do it, and then I sacrifice something else, right? So the ability to say no is not a bad thing. And you have to be willing to disappoint people and be okay with that to protect yourself, right? Because if you're not protecting yourself, you're not going to be able to be the purpose-driven person that you want to be, right? You have to be true to yourself, which is one of the hardest things to do. You have to schedule downtime. Okay, and that's where that 10-3-2-1-0, 2 hours before you go to bed, have some downtime, right? Just read, meditate, relax, spend time with your family, spend time with your kids. I mean, these are all going to improve all of the things that are important within your body. Personal development. Okay, we have to invest in personal development. You're in this room, you're already investing in personal development. It doesn't stop here. You have to be reading all the time. You have to be finding people that are mentors. All of these things which will help you with your success. Continuous learning, improved relationships, greater fulfillment, enhanced resilience. Any questions on that? Probably stuff that you guys already know, but just wanted to reinforce it. What's that?
That's perfect.
Yeah. So let's then move on to some of the foundations of health. So diet, exercise, supplementation, intestinal health, right? Really important. So there's a lot of different diets out there, but prioritizing a balanced diet, strategic supplementation, and gut health paramount, sustaining peak performance and overall well-being. So have you guys heard of the microbiome before? No. So it's in your gut, right? We have more bacterial DNA in our bodies than we have human DNA. And most of it lives in our gut and our respiratory tract and on our skin. These bacteria are so important for all of our functions, right? And you just read a book on it, right? So we have a mucus layer in our intestine. There's one cell layer between that mucus layer and our bloodstream. All of the stuff that we bring into our bodies throughout the day is protecting from going into that bloodstream by a mucus layer. If that mucus layer erodes through bad gut health, then all those toxins that we bring in are going to go right into the bloodstream. It's called leaky gut syndrome, and that can manifest in so many health problems: anxiety, depression, skin problems, diabetes, hormonal problems, fibromyalgia, autoimmune diseases, Hashimoto's disease, thyroid problems, adrenal problems, chronic pain, you name it, starts in the gut. Okay? And most people don't realize this. So let's, I kind of skipped ahead of myself because I get really passionate about gut health because, huh?
They say it's your second brain.
It is your second brain, which I'll get to in a minute. But let's talk a little bit about supplementation and diet. So nutrition, very important. Now there's tons of diets out there. I don't know which one's the best, whether it's vegetarian or carnivore or paleo or low FODMAP or whatever it is. It has to be a consistent, whatever works for you. I'm a big fan of the paleo diet. I like the lean meats, and it's more of a Mediterranean diet. I think it's really important to get your vegetables, get all your greens, which you do with a paleo diet. So I always promote that in my clinic. If people are vegetarian, I obviously can't, so I kind of do something else. But I do a lot of diet nutritional counseling in the clinic. One of the things about diet I think is important when you're talking about anti-aging and you're talking about immune function and just overall physiologic success, getting into a ketogenic state has been shown time and time again to be very important. Now, that's difficult because there's no way to measure it unless you're dipping your urine for ketones every day. And you can easily slide into starvation. And that's where you don't want to be, right? So even people that come into my clinic that we're doing weight loss on, and they're like, oh, I'm eating 900 calories a day or this and that. I'm like, that is not good, right? That is not healthy because you're in starvation. Your body's saying, doesn't know when it's going to get its next nutrients. And you'll lose weight up front at the expense of muscle and bone. And over time, you will not lose weight because your body's going to try to hold on to everything it can. Your cortisol levels are going to go up because your body's stressed out because it thinks it's going to die. And then you're going to have all these other chronic health problems. So when I do weight loss in my clinic, while we do use weight loss medications, I also put them on a very reasonable caloric intake. We do their body composition and everything, but very reasonable. Because the other thing with diet is that you want to do something that's sustainable. These fad diets are not sustainable. If you're doing a 600 calorie, 900 calorie, you're miserable, you're not going to do it. It has to be reasonable. So I feel that if you're working out and you're exercising, and we'll talk a little bit about exercise, and you're on a fairly consistent, you baseline caloric needs, burn off or even a little above and burn off the rest with exercise and do it consistently, you usually will have success at sustaining that weight loss and having a healthy diet. But it's just like anything else. You can't make all these changes all at once. You have to take little chunks at a time because that's how habits are formed, right? It takes about 90 days to form a habit with whatever we're doing. And so when people are like trying to make all these changes all at once, they're going to set themselves up for failure. So like when we counsel, I just tell them, let's just make this change. Let's work on that for a little bit. It's kind of like a golf coach, right? Where they're like, let's just work on the takeaway. Now we'll work it up to here. Now we'll work on the weight shift. Now, so that's how you build the foundation of diet and any sort of health, right? So, but a healthy diet will help with muscle recovery repair, brain function. Like Jesse was saying, it's the second brain. So there's a lot of neurotransmitters that are going between the gut and the brain. There's more neurotransmitters in the gut than the brain. So a lot of our serotonin, a lot of our dopamine is coming from the gut and then interacting with the brain. So people that have poor diets and poor gut health often have mood disturbances, depression, anxiety as well, sleep disturbances. So balanced macronutrient intake, nutrient timing and hydration, all important. Alkalinization, very important. And I wish Thomas was here because alkalinization, bacteria, viruses, cancers, anything can't live in acidic environments. Most of our bodily functions do better in alkaline environments. And so that's anything above a pH of about 6.5 to 7. 6.5 is technically not alkaline, but in our body, it's considered alkaline. So I treat a lot of cancer patients, and then one of the things I do is alkalinize them, and I have them checking their urine and making sure that their pH in their urine is above 7.3. So now we'll move on. Any questions on diet? And I don't want to make a recommendation as a blanket categorical, like you should be on this diet, because it's very customized for, yes.
Just a quick question. What are some of the fruits or stuff that we could consume to increase testosterone, whether it's taking zinc and magnesium.
Yeah,
Is the
well, we'll
placebo
get to
effect?
hormones, but yeah, just quickly, like zinc, magnesium, very good for testosterone. No, avocado's good, but there's some other supplements like boron, and we'll talk a little bit about ashwagandha. There's adaptogens that are really good for managing that. So this is what happens with a poor diet, though, and this is what people don't know. Lots of people have food sensitivities, and it can range anywhere from having a lot of GI problems to not having any GI problems, but having a lot of health problems. And the way it works is the foods are antigens, and they will interact with the immune system, and then it will cause an immune response that will release histamine, prostaglandins, which will cause total body inflammation. And then you end up getting a lot of these problems here, anywhere from inflammatory bowel disease to metabolic syndrome, which is like a pre-diabetes, weight gain sort of syndrome, heartburn, ear problems, ADD, migraines, even autism can be treated by treating the gut. So people come in, they're like, oh, I eat clean, I eat this, I eat that, all I eat is vegetables, but I still feel like crap. So I'll test them for this, and they'll be sent. We test for like 140 food sensitivities, and they'll come back and they'll be like, oh, well, I'll tell them, I'm like, well, you're sensitive to broccoli. They're like, what? I'm like, yeah. So they cut broccoli out, and literally, I've had people come back 2 weeks later like, I feel like a different person. And who would have ever thought that broccoli would have been something that someone would be sensitive or cause a problem, right? So we don't know what we don't know till we know, right? Are you? Yeah. So you know.
And I love broccoli.
Yeah. Well, I had a lady who was sensitive to tomatoes, and I told her she couldn't eat tomatoes. She broke down crying in my office because huh? Yeah.
So what does it mean when someone's sensitive to broccoli or tomatoes? Is it because I'm assuming if they don't know, it's not an allergic reaction.
It isn't. Well, it is, and they just don't know it. It may manifest in many different ways, right? It's usually people who are getting tested for food sensitivities aren't people that aren't having problems. They're having some sort of problem, right? And that's why they come to my clinic in the first place. So I always start with the gut because that's where most of these things can start to be solved. So we have to fill these nutritional gaps. So there's some supplements that enhance performance. Creatine, caffeine in moderation is okay. Beta-alanine, they improve exercise performance, increase strength, delay fatigue during high-intensity activities. There's other things that support recovery. Recovery is really important, not only physical, but mental recovery. So branch-chain amino acids, super important. These are actually help with gut health as well, and as well as muscle recovery. Omega-3s, great for hormones, and they're great for joints and great for cardiovascular health. They're anti-inflammatory. So if you can get your omega-3s, that would be great, and promote recovery from exercise-induced damage. So these are some other things that are really, when you're talking about optimizing health, these are things that I usually recommend in my clinic. So I'm really big on antioxidants. Glutathione is the master antioxidant in our body, and there's a lot of things that can happen when glutathione levels are low. One example is something called Hashimoto's thyroiditis, which is an autoimmune process that antibodies attack the thyroid. Well, a lot of that happens because glutathione is depleted in the body, also bad intestinal health and bad hormone health, but we won't get into all that. You have Hashimoto's? Yeah, I have Hashimoto's too. Although my antibodies are now down because I actually got healthy. You can actually cure Hashimoto's by fixing the gut and doing a lot of other things. Yeah, yeah. But so like one of the cures for Hashimoto's also is taking selenium, because selenium will increase glutathione in the body. But you can supplement glutathione. There's drops that you can use in your whatever green drink you're taking, or just put it in your drink. There's other things like alpha lipoic acid, which is easily bought, Walgreens, CVS, Amazon, 200 milligrams a day, great antioxidant. Vitamin C is one of the best antioxidants that we can be taking. People really underestimate the power of vitamin C. At least 1,000 to 2,000 milligrams a day, super important. They neutralize free radicals, reduce oxidative stress, and support overall health and well-being. And then vitamin C also really important for collagen. So vitamin C and zinc, if you're working out, for muscle recovery, for collagen production, skin, immune function, vitamin C and zinc, super important. Super important. Zinc you need to be taking about 25 to 50 milligrams a day. So one of the other things, so I think I have a slide on, yeah, we'll talk about that. Okay, so we talked a little bit about this already, right? The gut, yes.
You're testing for food sensitivities. What do you look
For the food testing?
at? Yeah, is that blood test?
It's a blood test. Yeah, it's a blood. We draw it in the office. Yeah, and then we get about a 35-page report back.
Based off genetics.
Nope, it's antigen testing. Yeah. So we talked about the gut being the second brain. One of the things about the gut, spermidine. Has anybody heard of spermidine before? No. Okay. So spermidine comes from wheat germ. There's a process in our body called autophagy. Have you heard of autophagy before? Right. So autophagy, for those of you who don't know, is the way our body detoxifies. It cleans out the mitochondria. It basically means auto-eating. So we eat all the bad stuff. Our body eats itself pretty much and then makes room for new cells. It cleans out the mitochondria. The mitochondria is the powerhouse of the cell, makes all of our ATP. It metabolizes oxygen. One of the leading theories of aging is now the mitochondrial theory. So there's a huge push for mitochondrial health in health and wellness. You can actually do mitochondrial testing. I had my mitochondria tested recently. It was pretty interesting. But keeping those mitochondria going are super important. And so one of the things, and then when it comes down to the gut health and everything, the mitochondria is super important. Brain health, mitochondria is super important. Spermidine puts you into autophagy 24 hours a day. The only way you can get into autophagy normally is through exercise and fasting, which is great. But imagine being in that detoxifying state 24 hours a day. Right, and this is a long-term thing. It's not like you take spermidine and you wake up the next day and you're like, oh, I feel like a superhero, but it is a long-term. Some people feel really good. I had a lady take spermidine and she could never grow her hair and nails, and then after taking spermidine, she came in. She's like, look, I don't have to get my nails done anymore. And there, yes.
So you were talking about earlier that we stress our bodies by not eating enough or very low calories, and now you just mentioned fasting. So how is that working?
So intermittent fasting is different than fasting, right? So intermittent fasting is a 16-hour fast with an 8-hour where you're getting all your calories during that 8 hours. So you're not really caloric restricting. You're just putting them into a certain time period. Now, I'm not saying that caloric restriction in itself is bad. You just have to be careful with how much you're restricting, right? You don't want to go into starvation. So this is really, there's so many studies on spermidine now that they're actually thinking about, the FDA is thinking about taking this from a supplement to a vitamin. And it's protective against neurodegenerative diseases. It's really a great kind of long-term health supplement. So we kind of went over a lot of the gut health stuff already, but I got ahead of myself on that one. So our immune function really starts in the gut as well. So when the gut is not balanced, our ability to fight off disease, not so good. Mental health, super important for gut health, right? ADD, ADHD, anxiety, depression. I have a whole gut health protocol. It's a 6-month program that we do in my clinic where they've come in feeling awful, and then within 6 months, they feel like different people once you get their gut repaired. We do a DNA test. We do a stool sample test. We get everything tested. Then we do a custom supplementation for them based on DNA analysis. And then over time, you can see significant transformation. So a lot of the chronic health conditions like diabetes, obesity, cardiovascular disease all start in the gut as well. So if you can get that optimized, that'd be great. If you don't want to come in and get tested and all this stuff, at least consider taking a probiotic at home. And if you've had to be on antibiotics, anytime you're on an antibiotic, take a probiotic, because the antibiotics will wipe out your gut flora and then you'll have to be kind of restarting again.
Excuse me, do you recommend taking both probiotic and prebiotic?
Pre and pro. Yeah, so do you guys know the difference between pre and pro? So prebiotics are fiber-based and they basically feed the existing good bacteria, whereas the probiotics actually come in and re-inoculate the gut with the bacteria that it needs. So yeah.
So when we go through your program, you're going to work with us on diet because isn't chicken and beef have so much antibiotics in there that we have to get enough.
Well, that's the
antibiotics to offset it?
that's the importance of eating organic, if you can. Yeah, I mean, if you can eat organic, it's much better. Hormone free, yeah, cage free, hormone free. You're gonna get, yeah, because we're seeing a lot of not only from that, but in men we're seeing a lot of low testosterone in young 20-odd-year-old guys, and some of the thoughts on that is the food supply and what's being put into it, and leading to all these hormone problems. So, yeah. So lifestyle choices, nutritional gaps. Have you guys heard of adaptogens at all? Adaptogens? No. Adaptogens are basically substances that help the body mediate stress responses. So one of the most common adaptogens that you guys may know about is turmeric. There's turmeric, right? So turmeric helps decrease inflammation, decreases cortisol levels. It helps with mental health. It's supposed to be neuroprotective, anti-inflammatory. Other ones are things like ginseng. Ginseng's an adaptogen. Decreases ACTH, which helps decrease cortisol levels, but it also helps the immune system quite a bit. There's another one called holy basil. It's big in Ayurvedic medicine. Holy basil is really good for decreasing cortisol levels. And ashwagandha is an adaptogen. So some adaptogens, you should be taking adaptogens about cycles of about 6 to 12 weeks and then rotating so that your body doesn't get too used to it. Yeah. Yeah. And then
rotating out of them or
rotating to a different one. Yeah. So your body doesn't get used to it. And there are some adaptogens that you should take in the morning instead of the evening. And there's actually been randomized control studies that show the benefit of adaptogens. One was with ashwagandha, where they had 64 patients that were randomized to placebo versus ashwagandha, and their ability to tolerate stress through specific measures increased significantly when they were on ashwagandha. It was 300 milligrams twice a day in that study. So there's specific dosages, and then some you need to take in the morning because they're activating, like ginseng and rhodiola, but other ones like ashwagandha and holy basil are better taken at night because they're more asleep. So, but they are an important part of supplementation. So let's move on to some cool stuff. So biohacking, we do a lot of this in my clinic. Biohacking is the art and science of optimizing human biology. It involves experimenting with lifestyle modifications, supplements, cutting-edge technologies to enhance performance, health, and well-being. So this is cool because there's so many things that are coming out in biohacking. So when you think of biohacking, you don't have to think about all this technology. There are certain things we do every day that's biohacking. Like if we took a cold shower, that's actually biohacking.
About, what do you call it?
Cold plunges? Yeah. Yeah, so that's biohacking, right? Infrared sauna, biohacking, right? So you don't have to, there are things that you can do at home that are biohacking that you don't have to go to big centers and pay a lot of money for. But it does help to go to those centers to do that. But they do improve resilience, they optimize vitality, and optimize physiology and psychology. So let's talk about some of them. So I'm sure you guys have all heard of red light, infrared light, specific wavelength of light. And basically what it does, it acts on the mitochondria and it improves ATP production about tenfold. And it also improves oxygen metabolism, so you're not producing all the free radicals that you normally get from just breathing oxygen. Oxygen is actually very toxic to our body, but it's also very necessary.
What's ATP?
ATP is a molecule that's formed in the mitochondria. It's adenosine triphosphate, and that's what we use through all of our energetic cellular functions in the body. So like ATP is responsible for muscle contraction, and actually it's more responsible for muscle relaxation. So that's why when we die, we get rigor mortis, because we don't have any more ATP and the muscles lock up. So ATP is super important for all of our physiologic processes. So when you're talking about aging and even healing wounds, hair growth, red light, really important. Even for pain, red light, really important. There's about 10,000 studies on red light now. So it reduces inflammation, enhanced muscle recovery, mitochondrial function. Ozone therapy is super important, really beneficial. Big in Germany. It was actually invented in Germany. In the United States, it's never been accepted or adopted. There's very few practitioners that are using ozone. I use ozone. Actually, it's becoming more popular now, but ozone is antimicrobial. It's anti-inflammatory. It has oxygenating effects. Improves immune function, detoxification, enhanced circulation, and there's been a lot of research done even with HIV, which was for some reason abandoned. It actually killed HIV, but for Lyme disease, works really well. I've used it in long haul COVID, or people that are just having fatigue, energy problems. So we have a system in my clinic. It's a 10-pass system where we hook an IV up and we put blood in, draw blood out, put it into an egg. We pressurize it with ozone and then reinfuse it. We do that 10 times.
You do that with your own, with the patient's own blood?
Yep. Yeah. So this is another good one, pulse electromagnetic field therapy. So this is great for muscle recovery, any sort of injury. So the way it works, it was actually invented by NASA. NASA, when astronauts were going into space, they were losing the Earth's magnetic field and they were getting sick. When they came home, they were getting flu-like illnesses, they were getting joint pain, muscle loss, all sorts of stuff. So they started setting them up with PMF devices and they were coming back healthy. So since that time, there's been a ton of studies done on PMF. We have great success with it in our clinic. I mean, it's immediate. So the way it works, it actually increases blood flow about 30 to 40%. In the small vessels, so you're getting hyperoxygenation, and it's also anti-inflammatory. So people that, like, I treat some athletes that come in that they've strained a muscle or something like that, and we do PMF, and they walk out and they're like, I don't hurt anymore. So acoustic shockwave therapy is another device we use. Also helps activate your body's own stem cells, decreases inflammation. So we do this with a lot of musculoskeletal problems as well. We also use this for erectile dysfunction. It works pretty well. But I'm sure nobody has any problems with that. Stem cells, obviously a very controversial topic. Most people think you can't get stem cells in the United States or that it's illegal. If anybody listens to Joe Rogan, you'd think the only place that you can get stem cells is in Tijuana, right? I am convinced he's getting some kickback from these people back there. But we are on what's called an IND with our stem cells. So we do it under the scope of research. We're above board with the FDA. Compliant, but we use stem cells for a lot of different reasons: anti-aging, recovery, joint rehab, a lot of these things. They come from umbilical cord blood. Moms donate their placentas. We cryopreserve them, and then we thaw them in the clinic. They're live cell lines. They continue to replicate for about 3 to 6 months, and we've seen great results with them. So this is something that I think would be really good for anybody in this room. I don't know if you guys have heard of photobiomodulation. So it uses, basically photobiomodulation uses light and sound to create physiologic changes in the body. And this is a great biohack. There's a company called BrainTap. I know their founder very well. He's a friend of mine, Dr. Patrick Porter. This device hooks to an app. It has pulsed light that goes right to the pineal gland, which we talked about the pineal gland. So it helps reset circadian rhythm, and the protocols, there's hundreds of protocols in the app. So anywhere from fitness to relaxation to meditation. There's different brain waves in our body that create different flow states. So there's alpha waves, which is really when you're trying to be productive and being a high performer, being in alpha state, super important. Right, most of the time when I neurotest people in my clinic that come in, they're mostly in delta. Delta waves are our slowest waveforms. Those are our sleep waveforms. So most people are walking around in a fog every day in delta, and they're wondering why they feel awful, right? And it's probably because all their hormone problems and their diet and their poor sleep patterns and everything else we talked about. But this thing, it takes the work out of meditation. So it's like meditation without the work of meditation. And there are 20-minute protocols. Like I said, they even have ones on golf. They have ones on living a Christ-centered life. They have ones on attracting living your purpose. They have just frequency training. So they have training that will get you into alpha.
That's what I was about to ask. How does it know what frequency? How does
So-
it know what frequencies and how does the
Yeah.
frequencies work to get to that?
Yeah. So the pattern of the pulsing in the light goes straight through the optic nerve into the pineal gland. The frequencies that are encoded into the audio,
Who encoded them?
Dr. Porter. He's a neuroscientist. He's a PhD. Yeah. Yeah, Patrick Porter. So many professional athletes are now using this. Tom Brady now is about ready to formally endorse this as a training aid as part of TB12. But this is something that I think everybody can benefit from. It's great. I mean, instantaneously, I can neurotest you before and I can neurotest you after, and you can see a shift into where you need to be. So let's talk a little bit about hormones. Hormones, biggest piece of the puzzle for foundational health. It starts with the hormones. After 25, our testosterone levels start dropping, and then around 50, they take another big plunge. So I'm about there. I'm gonna be 50 in a couple months. But there's something, women go through menopause. I always say men go through manopause. But this is the people who suffer in silence. Right? These are the men who feel like shit. They can't keep their body mass up. Their sex drive's going down. Relationships are suffering. They can't be high performers in their jobs because their motivation is not like it used to be. They just don't have that edge that they used to have. You test them and their testosterone levels just in the crapper. Right? They've gone to their doctor, like I said, and the range of testosterone runs from 250 to 827 on the labs. So if you're at 250, your doctor will say, oh, you have normal testosterone. Normal testosterone really in a 25-year-old is around 900. Right? So, and there's no reason that I, as a 49-year-old, should have a testosterone at 250 and feel like crap and someone tell me that's normal because it's in the normal range, right? So getting that hormone optimized has so many benefits. It's not just the immediate benefits of the increased energy, the ability to have effective workouts, to be more productive in your personal and professional lives, to have better sleep, to have better mood. It's the long-term benefits. Right? So protection from cardiovascular disease, protection from neurodegeneration, protection from osteoporosis. There's even studies now that show that may even protect you from prostate cancer, which 20, 30 years ago, they thought testosterone replacement caused prostate cancer, but there's been plenty of studies now that show that's not true. And in women too, the hormone balance, super important. I mean, women sometimes even come to me and they're like, my doctor, I told him I feel like crap, he put me on an antidepressant. And so you test them, you get them on hormones, and everything changes for them. So this is foundational, right? It's foundational. So everything else that we talked about, sleep and gut health and all that stuff, is great. But if you don't have the hormones to actually have the cellular processes and the physiologic reserve that you need to have all that stuff make sense, it's not going to work as well. And as men, as we, like for me, I've been on testosterone for a couple years now, and like I don't have to work out that hard. And just on a side note, when you're talking about working out, what's better, cardio or strength training? What do you guys think? Strength training? Strength? Strength? Okay, so there's actually a study that came out that looked at this. And so people that only did strength training, they actually did have a big reduction in mortality, about 9 to 22%. People that did cardio had a reduction of 24 to 34%. So on that level, yes. But when you combine the strength training and the cardio together, their mortality risk reduction was almost 47%. Okay. So, and I'm not talking about 2 hours of cardio. Okay. Have you guys heard the 30-30-30? Right? So wake up in the morning, 30 minutes of sunlight, 30 minutes of cardio, 30 grams of protein. Okay. Not that hard. And in fact, if you get up early, you can get your red light from the sun. If you go out in your yard naked, you get 5:36 in the morning. That's when all the red light's coming from the sun. Let's go. So, or you can do it in the evening time around dusk. So dawn and dusk is when we get all of our red light. That's when all of our ancestors got all of their red light. It was when they were outside, but we're not outside anymore. Which is another reason everybody's vitamin D deficient, because nobody's outside. My vitamin D was so bad I was having bone pain. Yeah, I had to go on vitamin D, and luckily I caught.
Vitamin D supplements help much?
Yes, but they have to be with K2.
Okay.
So vitamin D3, K2. Vitamin D3 helps absorb the calcium. K2 helps get it into the bone. But vitamin D is not just a vitamin, it's a hormone. So vitamin D governs a lot of our hormonal function as well. It also governs a lot of our mental health and a lot of our gut health. Vitamin D is one of the most important vitamins that we can be taking. So whenever I test guys for hormones, I always test their vitamin D levels, and you'll be surprised how many guys are deficient. Surprisingly, there's an epidemic of vitamin D deficiency in California, which is one of the sunniest states. So yeah, I mean, I guess if you're outside a ton, it would be good. But even those types of people, when I test them, their vitamin D levels may be close to normal. Like the range is from like 30 to, I think it goes to like 60. But I like to have my vitamin D levels up around 50, 60. Yeah.
Is that because you go outside fully clothed?
Yep.
Right.
Yep. We're not.
I
Yeah.
read a
Yeah.
study on that. You gotta go out
Yeah. You have to be naked. You got to be naked to get your red light. You got to be naked to get your vitamin D and everything else. Yeah.
You said it was vitamin D taken together with K2.
K2.
And
Yeah.
K2 was it K3 or just
No, just vitamin D3, K2.
What are common sources
You can't really, I mean, you can't deep leafy green vegetables, but really to get enough of it, you probably just better to supplement it. Yeah.
Would it affect you to take vitamin D if you have high levels of calcium in your system?
Yeah. So you have to be careful in people that have high calcium levels because then you can get kidney stones and that kind of stuff. Yeah.
I have my blood test and a little bit higher on the calcium.
How high?
I'll show you.
Okay.
And then one last thing, because you
Yeah.
didn't mention kidneys. Would it affect the kidney in any way if you have a kidney, kidney disease or anything like that?
Yeah, you have to be careful when you have those types of things. So that's why we always test labs. Yeah. But you can still take it. You just don't want to bump the levels up to where I would in someone that doesn't have those types of problems.
So the reason I asked is just I leak way more protein to my kidneys.
Oh yeah, proteinuria. Yeah.
But I don't think they were never able to pinpoint what it was, which is one of the reasons why I didn't even go to the hospital. They just had me like, take this, take that, and I ended up just working out, having a balanced diet, and when I went back, they're like, oh no, yeah, this is working, keep taking it. I was like, I'm not even taking it. I'm just working out.
Yeah.
Yeah, the workout sessions, man.
But you're not diabetic though, right? Yeah. Are you sure?
Not sure, but it does run in the family. But I'm definitely gonna have to take that.
Yeah, because diabetics are prone to proteinuria. So.
Recommended brand of these vitamins to take?
So, no, but there is a supplement company that I use. I don't sell it. I have no financial interest in it. I just love it, and everybody that I put on it, I loves it. Have you guys heard of Athletic Greens?
Yeah.
Yeah. So Athletic Greens is one of these supplements that really, if you just want to have an easy supplementation regimen and get everything that you need, aside from the reds, which you can easily just take another red supplement, but it has all your it has all your adaptogens, it has probiotics in it, it has all your plant-based, all your greens. It's just a powder. You just put it in your water in the morning. I add some methylene blue to it, and I add glutathione, and it doesn't taste bad. Actually tastes pretty good. And if you subscribe to that with a double subscription, they'll send you a year's supply of vitamin D3, K2 drops, sublingual. $79 a month, which a lot of people buy like 8 supplements, that they're taking for $300 a month. So, I don't want to get too much into this. So when you're talking about hormone balance, we do hormone replacement in my clinic, but there are some natural ways to optimize your hormones. It doesn't seem to raise anything from 250 up to 700, but it may get you to a level that may be satisfactory for you and how you're feeling. Ashwagandha is one of them. Boron is one of them. And then stress management, super important. Cortisol levels are known to decrease testosterone levels. Sleep decreases testosterone levels. Better workouts, high protein diets tend to increase testosterone levels. So really it goes back again, and that's why everything doesn't exist in a silo, right? Everything's interconnected. So sleep patterns can influence hormones. Hormones can influence sleep patterns. Gut health influences sleep. Sleep can influence hormones. Hormones influence gut health. So it's all interrelated. So when you're talking about a strategy, that's why it's good to be with a practitioner that can actually put all that together for you.
I know you talked about a lot of different types of diets, but I hear some people talking about this because, like, I wake up, I'm not even hungry till after lunch.
Yeah.
You know what I mean? And should there be a regimen no matter what diet you do, or do you listen to your body? What do you do?
So I think that keeping insulin levels constant is one of the most important things. And so so I always tell people, like, if you're not hungry in the morning, at least do a protein shake. Do something, right? Because what you don't want is to have that insulin so low, and then you eat this big lunch, and then you get this big insulin spike. Right? And so if you guys don't know, insulin is an anabolic hormone. It's a peptide secreted by the pancreas, and it actually helps us digest carbohydrates, fats, and put them into where they need to be. But when you have too much insulin, then a lot of that stuff gets converted into fat, and then fat makes you insulin resistant. And then once you're insulin resistant, then you get more fat, and then you get more insulin, and then you get more fat, and that's called metabolic syndrome. Metabolic syndrome is one of the #1 markers for long-term health problems. Insulin resistance is the silent killer. It's not just diabetes, it's actually insulin resistance. The good news is that it's easily treated. And I was insulin resistant. 7 years ago, I was 240 pounds. I was insulin resistant. I had Hashimoto's, and I just felt like crap. I just had my labs checked recently. I don't have Hashimoto's anymore. I'm not insulin resistant anymore. I have my hormones optimized. But it takes an intent, just like everything else, right? And it starts just foundationally, and it just becomes a lifestyle, right? So this is where we talk about work-life balance and carving out, because if you don't take this seriously, number one, your relationships are going to suffer, but your business is going to suffer too, because you're not going to be able to focus and put in the thing and be the best version of yourself to make that business flourish, right?
There's a silent killer, but are there any markers?
Yeah, I test for it. Yeah.
Resistance?
Yeah, absolutely. Yeah, we test for it all the time. That's one of the things I always test for.
But you can only find that by actually doing a lab test. There's not
There
like
are
doing
clinical
anecdotal-
symptoms of insulin resistance. So people that tend to get hypoglycemic oftentimes have insulin resistance. So like if you don't eat for a long period of time or something, or if you eat and then you crash, that sometimes is a sign of insulin resistance. Yeah. Okay. I put a lot of slides on hormones. Okay. So just in conclusion, thank you so much for letting me speak today. But, we talked about a lot of things, but sleep, super important. Relationships, personal development, got to take them seriously. Supplementation, diet, intestinal health, exercise. And then biohacking is something that we can help out with, in hormone optimization. So they're all interrelated. If you just kind of chunk these out and start working at them, make small goals, make small changes in 10 years, or hopefully shorter than that, maybe in a year or two, you can really have your health optimized, and you will be surprised how much your life will transform. So thank you.
Thank you very much.